Okay, and recording. Good afternoon, Darrell. Thank you so much for joining me today. I greatly appreciate it, and appreciate everybody that's tuning in right now on Facebook Live. We're going to have a little bit of brief discussion between Darrell and I, and then we will be happy to do our best to entertain any questions that you might have. And to be fair, this is kind of breaking news. Within the last 2 hours, the city just released their brand new Healthier at Home initiative to reboot Norman. And this is the proclamation and order that everybody I know is very interested in receiving. Outlines kind of the next steps forward for our community, whether it be individuals or businesses. So it's timely that we have Darrell on the hook with us today. So thank you so much for being here with me, Darrell.
Always a pleasure.
Well, to begin with, you've been on the job now for, well, how long have you been on the job?
About 9 months.
Okay.
No, going on 10.
So less than a year. You came from a very long and very wonderful career out in California. And I'm sure when you lived there, you thought about natural disasters in Oklahoma. You probably thought about tornadoes or things of that nature. When I think about natural disasters in California, I automatically think of earthquakes, but we probably all have, and here we are on Facebook Live, and I got a fly. A fly is my natural disaster. But whether it be fires or other things like that, they happen to all of our communities. So maybe talk to us a little bit about what your experiences were with natural disasters you experienced before, and how that compares to COVID-19 and what we've been going through the last month and a half.
You bet. The first disaster that I would quote label a disaster was a flood event. I was the finance director at the city of Porterville in California, and we had a heavy snowpack that winter, followed up by a very warm early rain. And what snowpack usually takes till about mid-July to make its way down through the Tule River Channel, made its way down in March, and all at once. And it washed out a bridge on Plano Street over the Tule River, which connected the south side of town to the north side of town. And that was my first experience in setting up accounting systems to be able to track all the costs incurred in hopes that we would be able to seek reimbursement from the state or federal government, depending on how big that event would wind up becoming statewide. And the process was fairly logical. And you make provisions, and once you go through that exercise the first time, you are mentally prepared to, at least do the bookkeeping side to ensure that your agency is eligible for reimbursement, which is a big plus budgetarily. Operationally, our department head team had been trained in standardized emergency management protocol, which is the system that allows a city government to reach out to county government and seek resources that are beyond our ability to manage. And then the county has the ability to reach out to the region, which is a handful of counties that are close enough by to help respond with additional resources. And then the regional directors can reach out to the state and bring in substantial resources. So those protocol, once you've been trained on it, you understand how the communication works to get resources delivered to you. You're actually in as good a shape as you can be. Nobody can afford, there's not an agency around that can afford to gear up and staff up for worst case scenarios when it comes to a disaster, but you want to make sure you've at least accounted for what your anticipated level of disaster response needs to be. And if you don't have the resources locally, you know where they are to go get. We had a couple of devastating fires in downtowns that affected, an entire block and dozens of businesses and, displaced dozens of residents. We were able to bring in resources from our county and from our region to support us in that effort. when it comes to a public health emergency like we're experiencing today, I heard it described this morning that probably the closest thing we could liken something like this to probably goes back to World War II, when everybody on the planet is affected kind of all at the same time to different degrees. It's definitely an emergency for everybody. So it's a lot tougher to reach out to your county or your region and ask for support, because they're all looking for the same resources you're looking for. So communication at that point does become key. Being able to share what you know with your counterparts, and be able to share access to resources. For instance, we found a vendor that was able to supply us with the KN95 mask, and this is the super heavy duty kind. It's got a really high filtration value to it. In order for us to get a supply here to keep our first responders covered, the minimum order size was 10,000. We recognized that was more than the city needed. We needed about 3,000 to cover all of our first responder needs. Made contact with our hospital, and they said we need 4,500. And then we made some other connections with some other healthcare first responders, and all of those masks were distributed and are now being utilized throughout Norman and Cleveland County. So that type of communication really helps get us all through. This is a scenario they don't really teach you about in college unless you're an epidemiologist, and then I'm sure it's right up their alley, and this is their senior comp paper written on what to do. But from a local government's perspective, we're relying on a lot of past practices for addressing similar issues. This is just the longest in terms of its runtime.
Okay. Well, it is unique, and whether it be a fire, a drought, a flood, tornado, ice storm, those are singular events that happen typically on one day during a specific set of time, and then you go about recovering and getting past that. And in this case, I was looking back on the calendar. I think we're in week 8, maybe, from when the kind of things started initially impacting locally. So this is quite a different experience for all of us. Well, I know everybody that's tuned in, which we're having great viewership right now. Everybody is very interested in the most recent proclamation that was just signed within the last 2 hours. And for everybody that's curious, I know that I'm sure, Darrel, that it'll be up on the city's website. If it's not already, it'll be there. Where would you direct them to go on the city's website to find the proclamation?
Our public information officer, Annalise Meyer, has put together a COVID-19 page specifically, and we'll make sure there's a link directly to the proclamation and the Healthier at Home Reboot to make it as easy to find as humanly possible. Definitely want to put that document in the hands of every interested business owner and resident of Norman. And I'll tell you, the lessons learned to date and information that we've been gathering throughout the process of planning for the eventual restoration to normal on a path. We've taken a lot of hints and clues from several of our local businesses, like our friends at OnQ and 7-Eleven, in terms of how they've hung some plexiglass barriers in between their cashiers and the customers, and little things that can make a difference. And when we share these ideas and lessons with the epidemiology world here in Cleveland County, they tell us there is value in some of the things that you would think. It's simple, it's inexpensive, it gives the employee a feeling of comfort, and it is effective in adding an additional layer to prevent the spread of COVID-19.
Well, so there's already, as you alluded to, there's already some great best practices that are out there. We've had a lot of businesses who have been under the essential category for a while, and so they've taken reasonable measures to protect their employees, their customers already. So if you're a business who is now looking to get back online and take that next step to get re-engaged, you might want to look around and look to some of those best practices. I do want to encourage people, whether it be on the city's website or you can go to the chamber's website, normanchamber.com. Later today, if not already, we will have the mayor's proclamation up there so you can read it for yourself. It's I think a 9-page document, 8 or 9-page document. So you need to look at it. It's for individuals and businesses. It's not just for one set of individuals within our community. But talk to us a little bit, Darrel, about how how the mayor, yourself, and the other team members of the city came to where we are today with the guidance that you provided our community.
I have been very impressed with our mayor and her desire to seek input from everybody. From a community survey that went out that generated over 12,000 responses from community members to business professionals, epidemiologists, and others in the medical profession, our hospital CEO to talk about, what capacity do we have in Norman Regional, and, where do we feel comfortable that, you can handle surges as they may present themselves as we begin to reemerge from our homes and get back to business. Input from every department head in terms of how our ability to provide services to the community could be done safely for the employee as well as safely for the public that we serve. Recognizing lessons learned from even the folks in our grocery stores. Early on, we had a news report of a positive test that came from one of our grocery stores. And I think initially everybody kind of paused and thought, oh my gosh, if an employee in a grocery store was positive, how many people could that affect? Well, through the process of contact tracing and then quarantining that particular employee who tested positive, we weren't aware of any additional positive cases that came from an exposure at the grocery store. So that began to shine some light that just because you've been exposed to a person who was COVID-19 positive doesn't necessarily mean there's been a transmission of the virus. So a little more comfort comes out of that. When we begin to look at statistics, of course, early on, the mayor's very first action back, I think it was March 13th, we were in anticipation of the president's announcement, and we activated the war room and turned on the big screen TV and had folks watching from a number of vantage points, looking for pieces that we needed to make sure we'd included in what we were preparing for the mayor, once again, to set ourselves in a position to be eligible for cost reimbursements, et cetera. And what we saw initially back then was what we believed a wave that would make its way actually from both coasts towards the center of the country. And New York had some real horrifying news feeds and clips. And we thought, well, New York probably is the worst case scenario. And we set out on a path to try to preserve our healthcare system's capacity and ensure that we did not run out of personal protective equipment in this task. And that was the primary goal. I think based on population densities and how we move in the Midwest versus how they move about in New York, probably one of those things that had protected our population to a much greater extent than the residents of New York have experienced. So she took input from an awful lot of people. We were happy to see guidance come out of the state of Oklahoma. We're paying attention to what's going on in Texas, as well as at the federal level. And those guidance documents, along with the input from our community, led to the Reboot Norman phased plan as she has posted.
Very good. Well, let's begin to walk through it a little bit. And I would encourage those that happen to be tuning in on Facebook Live, if you have any questions, feel free to post those in the comments, and I will do my best to relay those to our city manager. So I've had a lot of questions over the last few weeks about essential and non-essential, and particularly our small retailers, locally owned and operated businesses who've been much more restricted than other businesses. And so, how are they addressed within the new plan?
General retail, phase one, available Friday at whatever time they care to open. The opportunity to restore general retail in following a lot of the guidance from our grocery and convenience retailers. The goal to allow your employees to be masked up with something simple. It does not have to be a KN95 heavy duty mask, but any face covering does provide a great deal of protection. So if your employees can wear face coverings, whether it's a surgical mask or a cloth mask that they have made themselves, it's absolutely valuable. Statistically speaking, from our medical professionals, they gave us a scenario. Two individuals meet. One is COVID-19 positive. Neither individual is wearing a face covering of any kind. The odds of transmission in a 10-minute conversation is about 70%. They indicated that if the healthy person is wearing a face covering, a repurposed t-shirt, a bandana, a mask of any kind, it reduces the risk of transmission down to about 50%. However, if both individuals are wearing face coverings, the risk of transmission drops to about 1.5%. And that's just a huge number to take advantage of, especially now that we are finding greater access to face coverings, whether it's store-bought or handmade. So our smaller retailers, the opportunity for your employees to wear any kind of face covering when interacting with the public, and then just providing some social distancing at the register, just some tape on the floor, 6 feet apart. And if your retail clerk at the register is wearing face covering, great. If you have the ability to hang some plexiglass in front of them, even better. I think they will appreciate those efforts that the employers take to protect them from the customers, potential exchange of that virus. And then there's just listed, additional sanitizing practices. Keep your doorknobs clean, keep your countertops clean, use some disinfectant much more frequently than you may have in the past. And we think we'll be able to open up those small retailers with very little impact to the public health in a negative way.
I know in the order it directly or specifically mentioned CDC, and there are guidelines on there for businesses. Again, you can go to the CDC website or on the Chamber's website, probably the city's too. We have links to those guidelines. And so I would encourage anybody who's looking at how, if they're curious about what we need to do to make sure we're sanitizing our place of work properly, whether that's retail, an office setting, whatever, that's a great place to look. I know a lot of people are going to be asking and curious, as an individual, when I leave my home, am I mandated to wear a mask? What's the answer there?
You bet. Nobody is mandated, but it is strongly encouraged that when you leave your home, and it doesn't necessarily mean when I walk out of my garage and get in my car, if I'm going to go to the grocery store, but when you're getting back out of your car in that grocery store parking lot, if you can put on face covering, you are protecting your neighbors from a potential contamination. You may be an asymptomatic carrier at the time, and you putting on your face covering can help protect your neighbor. And we would hope that your neighbor would do the same to protect you. Those folks who are with symptoms, they usually figure it out relatively quickly. I'm feverish, I have a cough. And we do get reports regularly from our healthcare system about the number of folks who are presented at the hospital with symptoms that sure look like COVID-19. They are now tested, and the test results are coming back faster and faster. But even today, more often than not, what comes back is a negative test and the identification of either an allergic reaction or an infection of another kind. So we are optimistic based on what we're seeing in terms of the number of positive cases happening on a daily basis. Our ability to keep that risk low is to have as many people as possible using face coverings when they leave the house. We are protecting Norman and Oklahoma's most vulnerable when we participate in face coverings when we're out and about.
Yeah, like you said, it doesn't have to be a KN95 mask or even a surgical mask. It could be a bandana, T-shirt, a neck gaiter that you can pull up over your nose and your mouth. So there's a lot of options there for people to consider.
Absolutely. We're also anticipating opportunities for businesses to participate. We know we've got some great local vendors who are making gaiters and masks with some custom fabrics and custom logos and insignias. If your company has hats or T-shirts with your logo on it, I'm pretty darn certain we can get you gaiters and face coverings with your logo on that too. I, for one, absolutely anticipated and eager to see an OU football game where the crowd, instead of a whiteout, we're all wearing white T-shirts. We're all wearing, white gaiters with OU written all over it. I think it'll become a new norm. I think it will also help us through our next flu season as well. These are just good hygiene practices.
I'm not going to hold you to it, but you kind of just predicted football this fall. So I'm going to.
Oh, I am so hopeful. I was really, really thrilled that President Harris did indicate that students will be returning for the fall semester. We're hoping in the Reboot Norman phased plan that by the time August rolls around, we don't necessarily anticipate a period of time where we get 0 new cases for, months on end. We don't have months on end where we don't get any flu cases. Flu season is a big ongoing pandemic, tends to wind down about the 3rd week in May. We are hopeful that COVID-19 will also see a similar wind down in that 3rd week of May. But we anticipate we will continue to see positive cases throughout the summer, but we will be able to maintain PPE availability and hospital capacity to treat those who may be afflicted with COVID-19. So I am hopeful that all of these steps will allow us to return to football season. To me, that's just the best time of year.
Very good. And I'll put a plug in for a Facebook group that we have out there called Together for Norman Biz. If you happen to be a vendor who is selling masks, we'd be thrilled for you to join that group and post the information on that site, because a lot of individuals and businesses are going to be looking to purchase them. So Darrel, let's dive a little deeper into the actual plan. I know we had a question from a viewer who says, could you outline Reboot Norman, the phases and timing?
So phase 1 to begin on Friday. And I can tell you over the last couple of weeks, when staff and the mayor began to put ideas on paper in really kind of a giant whiteboard exercise, looking at what's been referred to as gating criteria. What do you look at in terms of medical trends and analyze to determine if we are truly past the peak? So that was kind of the criteria. Are we truly on a downward trend? We have gathered enough statistical evidence to indicate that we are on a downward trend. When it comes to new cases, we could be anywhere between 0 to 6 new cases a day. And it's really hard to decline much more than that. So we think as long as we stay in that range, we're definitely not going to overwhelm our hospital. And that allowed us to put the pin in the date of May 1 for that initial reboot starting this Friday. Primarily getting general retail back underway. The folks at the mall, I believe, are gearing up. We've had great communications with our mall management group, and they have adopted some wonderful criteria and protocol that they will implement to keep the shoppers safe as well as the employees who are working. We know the schools will continue to be closed throughout the end of the spring semester. Phase 1 will also continue to prohibit visitors from our senior living facilities and our hospitals. Those were honestly our hotspots, our convalescent care facilities. And we look at statistics in two categories: the city of Norman as a whole, and the city of Norman minus the hot spots identified at our assisted living facilities. That's not unique to Norman. Nationwide, those facilities did provide hotspots and the largest percentage of our numbers. So we want to continue to protect those people in those care facilities. We're excited that restaurant indoor dining will begin to resume and emerge. And the goal in similar scenarios to what we see in the retail side, social distancing just by, table spacing or seats if you have, bar stool dining, to be able to keep our patrons spread out a little farther. A family of four who comes in together should obviously be able to sit together at the table since they drove over in the car together. Makes perfect sense. The ability for our restaurant wait staff to wear simple face coverings. And we know your waiter typically doesn't spend 10 minutes with you at the table conversing before they take your order. So we feel pretty darn comfortable that our wait staff will be safe during this time of transition. The restaurants are really good about sanitizing, but I think the patrons will probably be more visually in tune to the sanitation measures being taken by our restaurateurs. Gyms will be reopening with social distancing, and I think probably a much greater focus on sanitizing equipment in between each use. And typically when we envision the gyms, the adults in the gym understand and recognize their need to keep everyone safe as well as themselves. But we recognize when you put childcare in motion, it's really hard to convince your 3 or 4-year-old, that social distancing is important. So when the gyms reopen on May 1, the childcare provisions in the gym will not necessarily be available on May 1st. Outdoor recreational activities, golf, tennis, pickleball, basketball, softball, and soccer will reopen. And practices will begin for our youth sports programs. And typically in the spring sports programs, when you're talking baseball, softball, tennis, etc., you're usually not talking about large groups really close together for extended periods of time. This will allow the teams to get back in motion, and then hopefully by the time games resume, there'll be the opportunity to have a couple of caregivers come and participate and watch each one of the children playing without too big a crowd, so we can provide some social distancing. Pet grooming can open by appointments, and that just reduces the number of people in the waiting room. And then dentists and optometrists will begin to open, and they're really good about their hygiene practices. So that'll be phase 1A, and then by May 15th, that first phase will evolve a little bit into phase 1B, where our churches will begin to provide those worship services. There is guidance under the Oklahoma's Open Up and Recover Safely plan regarding church services. It makes perfect sense, and I think it fits in well with what the mayor envisions for Norman. Personal care providers, hair salons, nail salons, tanning salons, appointment only. And we know about half of our salons do operate on an appointment by appointment basis, but the other half is walk-in. And what we've heard from our beauticians is the opportunity to walk in, leave your cell phone number, and just wait in the car. They'll call you as soon as your turn's up, so we don't have everybody sitting in the waiting room together. That seemed to make perfect sense from a lot of perspectives. And playgrounds, we expect to see our parks beginning to get busy again. We still want to prohibit visitations to our senior living facilities and our hospitals until May 29th, when phase 2 begins to open, and that assumes our hospital continues to maintain capacity for any surges. PPE continues to be available, and the county health department and the state of Oklahoma have the capacity to contact trace any of their positive COVID-19 cases then we're firmly in phase 2, where the entertainment venues, movie theaters, bowling alleys, and sporting venues can begin to reemerge with social distancing in mind. Community pools will open up with 50% capacity. Massage parlors and tattoo parlors can open by appointment, and gyms under normal operation, continuing that social distancing. Summer camps can provide services as long as they are able to follow protocol, and their employees continue to wear face coverings. Bars will be able to reopen at the end of May with limited capacity, about 50% capacity, and employees wearing face coverings, leading us to June, when we anticipate phase 3, the last phase of restrictions. Visitations can resume to our senior living facilities and hospitals. We know everybody will be wearing face masks, and I'm sure diligent hygiene rituals will continue. Our entertainment venues can return to 75% of their normal maximum capacity. Youth sports will begin to play organized games as long as we can maintain our social distancing and our spectators groups. Retail stores should be back at full capacity, and we're starting to think by the end of phase 3, it will look and feel a lot more like the Norman we're used to. I think face coverings will be part of the norm through the summer, but the goal is by August 1st, there are no restrictions, and that's when we anticipate beginning to welcome our student population back to Norman.
Okay, that's awesome. Well, I've got a few questions. First off, since with restaurants opening up on this Friday with limited capacity, I assume outside seating will be available. Is that true? And could restaurants potentially utilize more of their parking to accommodate people? Would that be possible?
We do envision that outdoor seating is absolutely acceptable as long as we can maintain our social distancing. So you may have every other table occupied on the outside. Reservations will be really, really helpful in speeding your customer experience. But a lot of our restaurants are really good about handing you a pager or taking your cell number so you can continue to walk around. As long as we're not gathering up outside, as long as we can maintain our social distancing, we expect those restaurants to open up, including the outdoor dining. And it will be interesting to see what the parking lots do look like come this Friday. I know there's a lot of anticipation, and personally, restaurant dining is entertainment, in my opinion, so it serves a dual purpose. And I know there's a lot of pent-up demand, and folks, we've been eating a lot of home cooking for a long time, and we're anxious to get back out to our local restaurants and experience some of the fine dining that Norman is known for. So hopefully we'll all ease back into that together. Throughout this whole exercise, the recognition that we will have people who don't feel comfortable with this proposal, and that's fine. And if you don't feel comfortable, by all means, continue to stay at home, continue to stay safe. It is recommended that people who are at risk, at greater risk, considered part of our vulnerable population, they should continue to stay home until they are given an all clear. And hopefully by August, that won't be a concern for even our most at risk.
I have another question concerning restaurants. So, will there be more specific guidelines for restaurants in the proclamation, such as single-use condiments, cleaning menus, employee temperatures, etc., or is it up to the restaurant to incorporate these new best practices?
So, best practices for all of us as we reemerge and head back to the workforce. There is some employer guidelines related to checking on the welfare of your employees. We're doing that here at City Hall as well. Taking a temperature check from everybody when they walk through the door to start their workday. Anybody with a temperature above 100.4 is suspect of being potentially COVID-19 positive. That is one of the symptoms that affects about 50% of COVID-19 positive people. So employers should be prepared to take temperatures. We have a digital thermometer you hold about 6 inches away from an employee's head, squeeze the trigger, their temperature pops up on the screen. It works really, really well. Single-use condiments, haven't even had that conversation. I think that's a brilliant point, but our restaurateurs are, I think probably the most keenly aware of what they need to do to keep their customers safe. I think we will see more of that. We do talk about monitoring our workforce for indicative symptoms, and make sure that if somebody doesn't look like they're feeling well, send them home. And that note to your employees, if you do not feel well, please stay home. While we continue to expand testing throughout Cleveland County.
And I think there is mention in the plan about guidance from the state and, of course, federal, DC, which there are, I believe, the State Department of Commerce has released guidelines or guidance specifically related to the food industry, I believe. So,
okcommerce.gov, and they have a COVID-19 set of plans and guidance for several business categories, including those restaurateurs.
Okay, and we had another mention just for clarification. The document says, this was a question that says reservations are required at restaurants. You mentioned
yes.
So is it required or recommended?
So when we say, and this kind of came out of the conversation from our salons, in that when your business is based on walk-ins, our ability to take you and put you in the chair, or take a restaurant customer and put you in a booth and begin to serve you is great. If you walk up and the seating is full, their ability to take your cell number and have you wait in the car, that's a reservation. So that'll work.
Okay, very good. We did have a question concerning high school prom and graduation. I know that's not directly addressed, I think, in the plan. That's the school system has those. Do you know off the top of your head where we're at with those events?
There were some small schools that did come up with some very interesting graduation proposals. When you're talking about how do we graduate 40 students, pretty manageable. It may take the principal and some of the administrative and teaching staff a while if each graduate comes in and gets 10 minutes for photos, heads out the door and drives away before the next grad, comes in with mom and dad and takes some photos. The school district is following the guidance out of the state of Oklahoma. I just saw yesterday a Facebook post from President Harris at OU talking about virtual graduation. And they were preparing, I think it's going to happen 10 days from today. OU will have its very first virtual graduation. Would not surprise me if that protocol fits nicely for our high school seniors as well. The prom is a challenge. Potentially a prom in August. It's a little, outside the norm, but that may be the way to accomplish that senior prom for those students who, it's one of those big measurements in life. Senior high school graduation and senior prom, those are big deals. Hoping we can facilitate those by the time we get to the end of this order, but definitely the subject matter jurisdiction for our school district, and I have a great deal of faith and confidence in their ability to give the students the most they can, given the current state of circumstances.
So what about other community events that could occur? As we're known as the city of festivals, so we have a lot of those. Even the chamber, we have networking events that host anywhere between 100 to 150 people, whether it's private entities like ours or a public event that occurs, Second Friday Art Walk, on and on and on. Where do those lie in this order?
In conversation as recently as this morning, our ability to get creative and maintain that festival, summer times are good in Norman. How do we hang on to as much of that as we can, and still provide safety measures? So these are discussion items. I'll just share them with you. Please don't share them with everybody else. But so we talked about how can we manage, maybe movies in the park or movies in the pool dive-in theater becomes drive-in theater. We do have a giant blow-up screen. We're going to see if we can't come up with a strategy to develop drive-in movies back in Norman through Parks and Rec. We're staying in our cars and we're listening to the audio through a radio channel in our car radio, and still able to experience social distancing. We even talked about, the 4th of July, that's my favorite holiday of all of them. We usually have all kinds of events scheduled in Reeves Park that bring out lots and lots of people. Maybe all those events don't happen, but our ability to say, look, there's some great vantage points from around Reeves Park. There's some wonderful parking lots. Maybe the fireworks show, we're in our car. We have an audio track that goes with the fireworks. We may be able to broadcast that over the same radio station as well, and we can still experience that fireworks display. We're just doing it in more of a individual tailgating kind of a scenario where social distancing can still be maintained. So we're trying to get creative. Some of our festivals are really a shoulder-to-shoulder event, and we'll be in conversation with all of our festival and outdoor summertime events sponsors to see how much we can deliver and still keep the public safe. So we're open to those ideas. I think our mayor is very enthusiastic about creative solutions to let us enjoy the best of Norman.
So the plan starts on Friday, and it's really I guess about a 45-day phased in plan, but or close to 45 days through June 12th would be the last phase. So when this whole thing started, and we went in phases the other way, where we gradually tighten things down. What if we continue to see positive outcomes, health outcomes? We're not getting as many infections, and deaths continue to drop. What if could this be sped up? Could the phases be shortened? Because we do have, even out to phase 3, that's a long time from now. 30 to 45 days is a long time. And so there are some businesses who I know are eager to open, and they want to do it in a restricted but smart way. So is there a potential that this order could be amended prior to the end of June the 12th?
Absolutely. And I think from the epidemiology and virology science perspective, a rolling 14-day window is valuable as it relates to COVID-19 and its typical incubation period. And if we are able to identify ongoing positive trends, I think the mayor is comfortable with the advice and consultation of OU epidemiology, OU virology. We ask a lot of a mayor to just, to deal with daily city operations, and then you heap a pandemic on top and say, tell us what we should do to keep the public safe. She has sought the input of local experts, and I think if the local experts become confident and comfortable that we can accelerate this process, our mayor would be happy to do so. She definitely does not want to go against the advice of our medical professionals. She has from day one been keenly focused on hospital capacity, personal protective equipment, contact tracing in its capacities. And now, as we see a real ramp up in test availability, those things give us confidence that we will have better data every day to build upon. And the goal to get back to as close to normal as quickly as possible is in everybody's best interest.
Very good. So as our residents and business owners read the plan, no doubt they're going to have some questions along the way. No one document can answer all of them. So where do you advise people to go as questions arise?
The Action Center at City Hall phone number. We always got somebody answering that phone. We're happy to track down and clarify, how does my business qualify? Where do I fit in? Is this an acceptable protocol on my part? or where can I get, face coverings, or I need more hand sanitizer. Can you guys help me out there? We're trying to make those connections on a daily basis. And on many occasions, we've been asked to interpret, how does my particular business fit in this plan? We're happy to spend that time and say, here's what we think. And based on our advice, please continue, under this course of action.
Okay. So people need to contact the Action Center either by phone or email with their questions. So
absolutely. We'll get right back to you. We get back to everybody.
Well, Darrel, as we wrap up our conversation, is there anything else you'd like to share with our audience today?
I'll tell you, when news of COVID-19 first started, end of February, early March, our staff, we met regularly, and we stayed in conversation internally about, well, what do we think that means? What do these trends begin to look like? And our sentiment the whole time was, look, if we're going to be criticized, we would rather be criticized for the actions we took than the actions we failed to take that resulted in real catastrophic impacts to the citizens of Norman. And I think we were relatively comfortable in our timing that, we didn't try to run out and jump in front of the president. When the president was ready to act, at least we were tuned in and paying close attention so that we were prepared to move as the president moved. And our requests to seek guidance from the state government and from health officials in the county and at the state level, I look back and I'm proud. I am confident that the actions taken were absolutely done with a primary focus of protecting the most vulnerable here in the city of Norman. And we talked through scenarios. If our hospital is at capacity with COVID-19 and you have a heart attack or you're in an auto accident, we're not just protecting people from COVID-19, we're protecting everybody in Norman by ensuring that we have that hospital capacity. So I think in the layered approach, how we eventually got to the current order, and then we're able to look for positive signs that we were past the worst of it, and then jump right back in and try to figure out how we open up without causing that second wave or a spike that would overwhelm our system. We feel pretty good about where we are today, and we do look forward with optimism that Norman's going to be okay when this is all said and done.
Absolutely. Well, Darrel, I appreciate your time and your leadership throughout this crisis. It's mean a lot, and we appreciate stepping up during this critical time to help lead our community along with the mayor and our other elected officials. Folks, thanks for tuning in today. You've been patient with us over the last hour. We appreciate that. I'll just remind you again, please go to cityofnorman.com. They've got a COVID page there that will have the proclamation on it. You can go to the Chamber's website, normanchamber.com. It'll be there. And I'm sure on the rebootnorman.com website, the proclamation will most likely be there also. Stay tuned for more information as it becomes available for you as a business individual. There's still a lot of moving parts during this crisis, and things continue to move rapidly. So stay plugged in. The Chamber and the city, both of us try to bring you timely information throughout this time. So you can follow us on Facebook, our Chamber page there, other social media platforms, or if you haven't joined the Together for Norman Biz Facebook group, that's a great exchange of opportunities for ways that you can support our local businesses. So until then, I hope everybody stays safe and stays healthy, and we will look forward to seeing everybody soon.
I got to say, Scott, you guys, the Chamber, have been fantastic. You've been a wonderful sounding board. You've been an access point to the public, and we could not do what we do if we did not have you and your Chamber members. So we are absolutely grateful for your participation, your willingness to jump on a call with us throughout this entire process. So Chamber members, we thank you, and we thank Scott through this whole process. He's been great. Thank you.
Thank you. We're honored to be a partner throughout this. So, okay, everybody, take care and be well. Thanks.